Hi, this lesson is about OT roles and services at the VA. And so, as we've been doing before, I've kind of just been presenting in a way as if you'll be presenting to the students. And so, I think it's first important that you ask the residents what their view on what OT is, that way you can have a general understanding and a perspective of where they stand as to what they know OTs do. Obviously, then you would want to give them a formal definition and explaining that occupational therapy is about helping people across the lifespan be able to participate in occupations that are meaningful to them through using meaningful occupations. Then you would want to pass out Appendix C and discuss the information that is on there. It's a more general and expanded view and understanding of what OT is. And so there's a lot of information on here, but you want to ensure that you're keeping to the 5 minutes time limit. And so I would say that you would just pick things on here that you would want to highlight. So I would do something like okay, OT has a very holistic approach to how they view things. There is a trilogy and a balance of the mind, the body, and soul. And when there appears to be an imbalance of any one of those things, there will be difficulties in ADLs and IADLs. And then we have various treatment approaches in how we address that imbalance. Specifically here at the VA, we work on compensating, so by providing durable medical equipment or self-care aid when the imbalance has not been able to be reached on its own, or we do rehabilitation and restoration in which the patient will go back to where they are independently to create that balance. Typical diagnoses, we have TKAs, BKAs, AKAs, strokes. Any change in functional status would be important and relevant for an OT to be working with someone. And also home supports or dispo recommendations. So whether someone needs a home health aide, a home nurse, things like that. The life alert, we can suggest those things. Or whether someone needs to be in a skilled nursing facility as well. There's also a hand therapist. Not many residents know that there are hand therapists here. There is a hand therapist here that works with individuals with hand difficulties, wrist drop, carpal tunnel syndrome, wrist ache, things like that, in which they can be assessed, and she can then determine how she wants to proceed from there. Some inappropriate consults that have been seen at the VA is the maintenance of skills. Therapists here do not work on maintaining a skill. That is not a clinical justification or reason as to why an OT or a PT should be working with a patient. However, if you feel that a patient during their time here will be conditioned, then it's important that you put in a mobility regimen, as we discussed in inpatient mobility, or restorative nursing order as well. Some other ones we've seen are suicide ideations, alcohol withdrawal, agitation, or nausea and vomiting. Again, there would be no need for those if there is no functional change in someone happening after things have been medically addressed as well. And I think one of the biggest ones that we see is COPD exacerbations. And I think it's important to know that unless a patient has not been previously seen during their multiple admissions, then that would be a time to put in a PT or an OT order. Maybe it's to work on fatigue or whatever you see is functionally changing or being affected, affecting that person would determine what type of consult would need to be put in. But however, if they have received therapy consults already in their previous admissions and have already been given mobility aid and have been given self-care aid, then there would be no need for a therapy consult to be put in. So yeah, I just picked a couple things in this handout that I felt would be relevant for me to present to the residents. You as the therapist, to your discretion, can pick the information that you feel is important and vital for them to know and understand during their time.